Welcome to Carson City, Michigan, where President Donald Trump's big, beautiful budget might just be the final nail in the coffin for the only real healthcare provider in this tiny town. This is So What Michigan, where we break down the news that actually matters for Michiganders, even when it feels like nobody else is paying attention. According to new reports from the University of North Carolina, more than 300 rural hospitals across the country are now at risk of closure, including this one, which provides everything from primary care to cancer treatment for the 1,100 or so people who live in Carson City, as well as a whole lot of other people in this rural stretch of the state. Two other hospitals, one in Mount Pleasant and another in Dowagiac, were also flagged in the report, mainly because they've already been operating in the red for years. Now, they're facing even more dire straits over the months ahead. Why? Because Trump's new budget, which all 7 Michigan Republicans in Congress supported, takes a buzzsaw to Medicaid. It cuts more than $800 billion from the program nationwide over the next decade and slaps strict new work requirements on millions of people who rely on it. By some estimates, 200,000 Michiganders will lose their coverage. And here's the thing, Medicaid covers about 40% of patient care in Michigan's rural hospitals. Take that away, and the math just doesn't work. Let's be clear, hospital officials here say they have no immediate plans to shut down, but they're worried, and they should be. With less funding, cuts are coming. First to services, then maybe more. For local patients, that could mean fewer staff and longer waits, or longer drives to the next closest hospital. And in rural Michigan, that's not always an option. And don't think this is just a rural issue. These cuts will ripple through the entire system. Up to 1 in 4 nursing homes in Michigan are set to close. Premiums are already rising. 30,000 healthcare jobs are on the line. And researchers say these Medicaid cuts could lead to 50,000 preventable deaths every year. So what? This isn't just politics and policy. This is life and death. And it's going to play out in hospitals like this one all across Michigan. If you're not okay with that, then it's time to say something.